Good afternoon, everyone, and welcome to our webinar this afternoon. I am Natasha Bonham, Director of Baby's First Test, and I am really excited to be able to share with you some great data from one of our Consumer Task Force members, and we're really looking forward to a great discussion about parent reflections on receiving out-of-range newborn screening results. So just to get started, we'll go over a couple of logistics. As always, our webinars are recorded, as this one is, and the link will be available on the Baby's First Test YouTube channel by the end of the week. If you have questions, please submit them using the chat box. You can send in your questions at any time, and then we will address the questions at the end of the webinar. If you have any IT or need any technical assistance, you can use the chat box to communicate with us directly. And there's a way that you can just click so that it sends it, I believe it says, to the organizers directly. So you can send that to us and we will help you along. And so with that, let's dive in. A little bit of background on us. Expecting Health is a program area of Genetic Alliance that focus on maternal and child health, so anything ranging from the prenatal period all the way through the first few years of life. This really is a program that's focused on connecting and bridging actionable information with the everyday realities of women's experiences and families' lives. So we really are interested in what is really happening with families and how we can make those healthcare experiences better. Many of you on the line are very familiar with our core program areas, including Baby's First Test, our Newborn Screening Family Education Program, our Perinatal Nutrition Collaborative, and our National Genetics Education and Family Support Center. So those are our core programs. There are a range of other activities that we are involved in related to both genetics as well as things outside of the genetics and genomics space. So Baby's First Test is really meant to bring together the latest information and resources to help guide parents, families, loved ones, and their health professionals throughout the newborn screening process. We really see it from a systems level. So as we all know, newborn screening is more than just a test. It's more than just what happens in a lab. It really is all those core pieces, all centralized around the experiences that families are having, whether there's a diagnosis or not at the end of that. Our audience, we oftentimes say it's everybody, but we break it down in a couple of different ways. First, with expecting parents, so really making sure that the messages are related in a way that expecting parents can understand why they should be thinking about this even before a baby gets here. We look to reach and engage new parents, so those whose children have gone through newborn screening or they may just be finding out about it, to help navigate what they should be doing, how they should follow up on test results. We also work really closely with healthcare professionals. We believe in it's not one side or the other, but really what is that relationship between families and their healthcare professionals. And we do a lot of work with the professionals listed here who are really at the front line of newborn screening and making sure that parents have a good experience and are well informed about what happens. We also work with industry and the public more broadly in terms of really being able to see what are the trends, what are people thinking about. Newborn screening does not live in a vacuum. It's part of a larger healthcare system, and really taking those learnings and implementing what we find from that to make a better experience for families. So since launching in 2011, we've had over 3 million visitors and over 6 million hits. And one of the things that we found in some of the work that we've done, and really what pushed us to really be about both families and health professionals, is though babiesfirsttest.org, many people think of it as for families. That's what we really pushed for. Everything is written for families to access it and have an understanding of it. We found that nearly 50% of the traffic to the site was coming from healthcare professionals. And when we thought about it, we saw that that really made sense. Everyone may different audiences may want slightly different information, but everyone wants to know what is the right language to use when they're engaging with families. And that's really what we learned and continue to push through our site. And when we've done some other survey work, we've seen that there is a high rate of people learning something that they hadn't learned before, or were able to find answers to the questions that they were looking for. So that is key. That's what we want in all of our efforts, that people are finding what they need and they can go on to their next step. On the site, there are a number of different resources. We encourage you to look at them and engage with them. And if there are questions or something you think we should add, please let us know. That is how this site that started off so long ago has grown into really one of the one-stop shops for newborn screening information, really from the family and provider perspective, really that frontline perspective of those experiences and what does it mean to engage in newborn screening that way. And some of the support and resources that we have available, and we're always looking to partner and to provide those opportunities for assistance, is to design and tailor educational materials. We've done a whole lot of that for Newborn Screening Awareness Month, which is this month. Also building out strategic education and training plans. So more than just creating a brochure, but what's the beginning, middle, and end of the plan for that? Who are you trying to reach? What are the goals? What does success look like? We're really here to help people walk through that and to really lay out what that means. We also work with states and other professionals to engage a range of different communities. We've done focus groups with nurses and midwives. We have a lot of experience in pulling that together, so we're happy to help, to share the types of questions we ask. Again, we don't want people having to reinvent the wheel over and over again. We really see ourselves as being able to be a foundation for the work that happens in newborn screening and to help people leverage their efforts and meet their goals. And an example of that is really to support the implementation of our newborn screening education best practices framework, which I know some of you are familiar with, that we have released last year and see a number of people are starting to use. But really just to have that framework of more than just creating one brochure or one poster, but really what is the educational approach you're looking to take for the audiences you're trying to reach. As I mentioned, it's Newborn Screening Awareness Month. That is September, and this has been, I will say, our busiest and most active month that I can think of in the past 11 years or so that I've been working in this, and the past 10 or so years that we've been doing this in a more focused way. We've created some new materials really focused on raising awareness and really getting the stats out about newborn screening. We have our social media toolkit. All of this is available for all of our partners to use, to download, to get out there. When you're posting about Newborn Screening Awareness Month, please use hashtag 2019NBS. Using that hashtag means that your messages are connected to other people's messages, and that really helps kind of leverage those posts and that information. And that is particularly important right now during this Newborn Screening Awareness Month. And so with that background information out of the way and hopefully a bit of an anchor, I am excited to introduce Allison Wood. Though earlier I was talking about a lot of the work that our website and our programmatic work focus on. Allison and this work that she's going to present here is a great example of some of the other work that we're really invested in. And Allison was a consumer task force member of ours, and obviously very motivated, as you're going to see by the information that she's going to present. But she took an idea that started off in that space and really built upon it to get a better sense of, you know, what is that experience that families are getting when they get that very first phone call about an out of range. So that kind of, some people call it a lightning bolt moment or a snapshot moment, but kind of that moment when things change. I don't want to give too much away, so I will turn it over to Allison.
Great. Thank you, Natasha, for the introduction, and happy Newborn Screening Awareness Month to everyone. I'm very excited to talk to you all about the results of the study that I did in collaboration with Baby's First Test. So to start with, I'd like to do a little bit of a literature review and just go over the past research that has been done in regards to the first contact that families get about an out-of-range newborn screening. And I want to look at it from the parent's perspective as well as the healthcare provider's perspective. And then from there, we'll jump into the results of this current study. And then from there, we'll go into the next steps in how to take this information and really build upon it. So since we have such a wide audience today, I thought that we would start really from the beginning and what is the goal of newborn screening. So the goal of newborn screening is to identify infants with severe conditions for which early interventions improve outcomes. And there is no federal mandate for newborn screening, but there is a recommended universal screening panel, and that's chosen by the Advisory Committee on Heritable Disorders in Newborns and Children. And that includes 35 core conditions, and most states are screening for at least 29 of those conditions right now. And if you remember years ago, back in the mid-2000s, there was a time where a bunch of conditions kind of got added all at once. And now again, with the advent of gene therapy and other new therapies, there's a lot of more rare conditions that are starting to be added to the newborn screening panel. And because of that, there's been an increase in actionable results that have to be communicated to parents. And the protocols for how this communication happens, it really varies by state and how time critical the result is. And certain specific disorders have different protocols as well. So kind of from a system-wide perspective, states differ in who is reaching out to families to let them know about these out-of-range newborn screening results. And across the board, the largest group of people that are contacting family members are primary care physicians. But again, that varies from state to state, and there are other healthcare providers that are making that contact. And again, even within states, the approach can change depending on conditions that have symptoms develop within the first few days of life, or conditions where symptoms present later on. In terms of parents' perspectives in getting this first contact about an out-of-range newborn screening, there was a study done of 30 families whose child had an out-of-range newborn screening result. And this study that found that parents were shocked by this first contact, which I think is really not too shocking. It's a shocking call to get, or a shocking contact to get. This study also found that time between the first contact and the confirmation of results was pretty distressful. And during that time, families were spending time gathering information about the condition. And sometimes that information gathering was inaccurate. And then after that, parents had to be re-educated by the healthcare providers that they met with. Another study was done that assessed parent satisfaction with the communication of abnormal Pompe disease results. And again, this study felt that healthcare providers should be better educated on the disease and should have more resources for families when they're communicating the results. And I thought they had a really great graphic in this study. On one side, they've got things that families can do to make this go a little bit easier, and then things that healthcare providers could do to make this just a little bit easier. And on the healthcare side, things that they suggested would be finding better ways to communicate the results, and then speeding up the diagnostic process, and then find more accessible and patient-friendly resources after a positive newborn screening. On the family side, I think we've all kind of heard to avoid Google, and really just giving yourself, know that it's okay to be upset and give yourself time to grieve. And since I'm going to be a genetic counselor, I thought it was great that they added in there that genetic counselors are really great resources. And they really are. Genetic counselors are able to help educate families on the specifics of the disorder, and they usually know some really great resources that are out there. Research that's been done from the healthcare healthcare provider's perspective, has kind of found similar results in terms of just knowledge and communication issues that have come up. So there was a study done looking at the communication of presumptive positive sickle cell disease and hemoglobinopathies. And this study found that knowledge of the conditions was poor and that confidence about the management of these conditions was only moderate. And another study that was done looking at primary care physician comfort in relaying positive cystic fibrosis results showed that there is variation in the method used for contacting families, which we know because it varies from state to state, but also that there was a lack of preparation and comfort with the notification process and difficulties with being the point of contact for families, including how to be emotionally supportive. And this study actually had a really great resource too in terms of recommendations for improving this notification process. And so some of the respondents thought that, again, having materials to distribute to families that just told a little bit more about what their process was going to be would be really helpful for families. And that special training for physicians would be helpful, specifically in how to break bad news, because getting a call when your infant is just a few days old is going to be scary no matter what. There was another study that was conducted by the Southeast Regional Genetics Collaborative, which surveyed primary care physicians' knowledge and comfort in communicating abnormal metabolic conditions to families. And this study, again, found that primary care physicians felt that more training was needed in how to best inform parents about these out-of-range results. And they had a great resource in this study too, where they asked primary care physicians to rate the importance of specific topics that they might touch on during this call with families. And pretty much across the board, all of the topics that they listed, people thought were pretty important. The one that got the lowest amount was the research on long-term outcomes, which is kind of interesting because, as you'll see from the results of this study, families do want to know if there's treatments available for conditions that would impact the long-term outcomes. When people are going to Google and looking up these conditions, if they don't know that there's any treatment, it's much more shocking than if they were going into the research knowing that there is treatments. So now we'll move on to the results of this study. And really what we wanted to do with this study was determine who is contacting parents and really use that information to see if there were changes in satisfaction on that first contact based off of who was contacting parents. And then we also wanted to evaluate what information was being given to parents and then determine if there was any additional information that parents had wished that they had received during that contact. So this was a 13-question survey, and we really wanted to keep it short so that we could try and increase the amount of people that took it. The study was approved by Genetic Alliance IRB. There were a few stipulations, and one was that we wouldn't cross more than 2 answers in order to protect identity. As you know, many of these conditions are very rare, and if we were to cross a condition within a state for a specific year, then it would be pretty easy to figure out who was using the survey. And then the other thing, the other stipulation was to only include people whose child had a newborn screening after January 1st, 2014 in order to increase recallability. We sent this survey out via advocacy organizations. So we contacted organizations that represented all of the conditions that were screened for odd newborn screening. And the organizations that wanted to participate were given the information to share with their membership. And Genetic Alliance and Baby's First Test also sent the information out through their social media channels and via email. We had 283 people who took the survey, and the average time spent was 5 minutes, so people were able to get through it pretty quickly. And just a few demographic facts, or just facts in general, 13% of the time the child was still in the hospital at the time of that initial contact, and 98% of the respondents had a child who was diagnosed with a condition. And so it's important to keep that in mind when I go through the results, as some of the results might change if we think about people who were getting a false positive versus someone who ended up being a positive. So here's a breakdown of the number of respondents that we had by state. Red is 0 to 4, green is 5 to 9, blue is 10 to 14, and purple is 15 to 19. And it really breaks out pretty much in line with the population of those states, other than we did have a few states whose newborn screening offices were able to kind of help distribute the survey through their systems. And I know this slide is not very pretty, but there are a lot of very long named conditions that are on the newborn screen. And we had a pretty large variance in responses by condition. We had a really great response rate from the PKU community. They distributed the survey through multiple channels. We also had a high response rate from organic acidemias and from fatty acid oxidation disorders, as well as hypothyroidism. Any condition that is listed on this slide had at least one response. So we asked who was contacting families about an out-of-range result, and we weren't too surprised to see that a pediatrician was the highest response rate. What was a little bit surprising is the percent of time that a nurse was contacting families, and based off of the comments that we received within the survey, most of the time that this was a nurse that was that worked at the primary care physician's office. Other responses were genetic and metabolic specialist or a genetic counselor. Some of the others that we received were neonatologists or nurse midwives, and then a few other ones. So we asked just a very general, how satisfied were you with the information that you received during that initial contact, with 5 being very satisfied. And it was a pretty even split between very dissatisfied up to very satisfied. So about the same amount of people were either very dissatisfied and dissatisfied, or satisfied and very satisfied. We were able to break it out by satisfaction of that first contact when either a pediatrician or a nurse contacted families. And you can see that there was a bit of change in the satisfaction of the information that people received when it was a nurse contacting families versus when it was a pediatrician contacting families. When you combine satisfied or very satisfied together, it's just over 25% when contacted by a nurse and close to 50% when contacted by a pediatrician. And looking at very dissatisfied or dissatisfied, 50% of the time when contacted by a nurse versus about 39% when contacted by a pediatrician. From there, we asked families to fill out in terms of agreeance to multiple questions, those being the person contacting had an understanding of the condition, the person was able to answer questions regarding the condition, I knew who to contact if I had follow-up questions, I had a clear understanding of the plan going forward, the person was emotionally supportive, and the person used language I can understand. And we took these from some recommendations about what should be relayed to families during that initial contact. When we look at these responses as an average, with strongly agreeing being up to 5, or strongly disagreeing being 1, you can see that the lowest response rates in terms of agreeance were for the person contacting had an understanding of the condition, the person was able to answer questions regarding the decisions, and also that I had a clear understanding of the plan for going forward. And you'll see in some of the comments that people had throughout the survey that some people were a little bit concerned with what the plan was after they got that first contact for what they should be doing going forward. In terms of the highest agreeance, the person used language I could understand was the highest rated. We also broke some of these questions out, again, by when a pediatrician contacted families and when a nurse contacted families, and we saw similar results as we did for kind of the overall satisfaction. You can see here when contacted by a nurse, when asked that if the person had an understanding of the condition, over 35% of the time when contacted by a nurse, people strongly disagreed. versus when contacted by a pediatrician, that was about 17%. And then again, when you go over to agree and strongly agree, when contacted by a pediatrician, there was a much higher percent that was agreeing or strongly agreeing with the person having an understanding of the condition. The same thing can be seen when we compare a pediatrician versus a nurse, when we ask if the person was able to answer my questions regarding the condition. You can see here again that when contacted by a nurse, there was a high percent who strongly disagreed or disagreed. And then when we look at a pediatrician, the percent was higher for agreed or strongly agreed. There's still about a 50-50 break though between, or an equal break between strongly disagree and disagree, and agree and strongly agree for a pediatrician. So I just wanted to kind of take a step back here and talk a little bit about some of the tools that healthcare professionals have when they're contacting family members. A lot of states use these act sheets to send along to primary care physicians to use as a resource when they're contacting family members. And they contain relevant information for the healthcare provider contacting the family, but are very clinical in nature. But it has the most important stuff that needs to be addressed with the family members when they're contacting them. And it also has lots of places for physicians to go to get additional information. But it doesn't really address some of the other aspects of making this phone call or this contact. So there were some communication recommendations that were made by the Advisory Committee for Heritable Disorders in Newborn and Children. And these are really great for whoever's contacting the family member to use in making sure that they're addressing all of the issues that might come up during this contact. So the first is to share what the specific result is and understand what a screening versus a diagnostic test is, knowing what a newborn screening is. And then engaging with the families and making sure to provide information at their desired level and pace. Some people will want a lot more information than other people will want. So being able to kind of go off of what the family needs in their situation. And then exploring the family's emotions and making sure that they have a support system or that they know about support resources. So as they're going through this process, they have people that can support them, because it can be a big emotional impact on a family. And then making sure at the end that the family knows what the next steps will be. So when and where is your next appointment, and what testing is going to be considered or done, and what should they watch for in their child, and then who do they contact if they have any questions or concerns. And then at the end, always making sure that the family understood everything that you were talking about. So with that all being said, the second part of the survey was really looking at what information people were given during this initial contact. And people were allowed to check everything that applied to them. So the name of the condition, background, information about chances of a false positive, who to contact with questions, websites with information on the condition, risks associated with the condition, signs and symptoms to look for, and then I do not recall. And so most of the time people were given the name of the condition, but all of the other options for the respondents that took the survey were under 50% of the time families indicated that they were given this information. And then we had a lot of write-ins too. And so I just want to talk about those a little bit, because there were some themes within the write-ins that people had. So there were some positive responses in terms of responses, and the themes here were, if there's a previous relationship with the physician, the experience of that first contact seemed to go better. And if the family already had an older child who had the condition, this first contact looked better, because it seemed to go better because they already knew that this was a possibility. So one of the respondents said she wanted to be the first to tell us because she had a long-standing relationship. While she didn't have a lot of answers, she did say that she will be in close contact with the genetic care team, and we will all learn together how to best move forward. I am very glad my first contact was not with a person I had never met. We also had some negative responses, and there were some themes there too. So people indicated that they felt they were given a false sense of security during this first contact, or that the person calling them had a lack of knowledge. So one person said, go to the ER immediately. If you don't, your child will be mentally retarded. If you have any questions, call doctor. That was the message left on my voicemail. Another person said, it's just a bad read. Your odds are better that you win the lottery twice than this being a thing. This wasn't the only person that indicated that the person contacting them had told them that their chances were better, that they would win the lottery than this being something. And then another person said the pediatrician laughed and said he would be retarded if he had PKU. There were 4 people who indicated here that they were given the wrong condition when they were contacted. So one person said the name of condition was given, but wrong. One person said I was actually told the incorrect name, but was able to figure it out on my own. Another said, we were told he'd failed the PKU test, but they didn't actually know which condition he tested positive for, since it tested for a variety of conditions. And another person said, given the wrong name, we were told of a similar condition, but not the condition our child had. The pediatrician messed up. So that was kind of the second part of the survey. And then the last 2 questions were questions where people could just write in responses. And the 2 questions were, was there any information that you wish you had been given during the initial contact that you did not receive? And the last one was just said, is there anything else that you would like to share regarding the first contact? And I really think that this is kind of the heart of the study, because so many people wrote in just a long paragraph about how their experience went, and it was some really moving answers. And so I'll just kind of go through the themes that we saw in these responses. So about 30% of the time, people said that no, there wasn't anything more that they needed, or they had a good experience. One person said, our doctor was extremely sensitive and supportive. In hard times like that, it is impossible to have all questions answered right away. Our doctors did the best they could with the limited knowledge they had. In terms of themes for more what else people needed during that contact, one of the themes was that the explanation lacked needed relevant information, and that could be broken down into subcategories where specifically accurate websites or resources, availability of treatment, support groups, or who to contact with questions were mentioned. And so one of the quotes from this were, I would have liked an informed explanation. Our doctor knew nothing about the condition and just said we needed to go to a metabolic and genetics hospital out of town and they could answer our questions. That led to a lot of online research and no sleep for my husband and I for 3 days. Worry unimaginable and broken hearts. He is a perfectly healthy boy, thriving greatly. In terms of the sub-themes, for accurate websites, some people said more information in general, being terrified and left to Google, which was even scarier. And another person said, an approved website with more information about condition instead of having to do my own frantic research as we rushed to the children's hospital. And another person said, I would have liked more information about a good PKU resource. We just went straight to Google, which wasn't a good thing. I understand that they want people to hear information directly from the doctor, but some type of resource would have been helpful. In terms of the availability of treatment, some of the responses that we got were once the specialty clinic explained that treated PKU wouldn't have the symptoms we read about, we felt so much better. I wish that was the first information we received. Another person said, we were given very vague information that led us to Google the condition and stress about the extreme long-term effects, then had a very terrible first appointment. It would have been nice to have someone explain that in the event it's not a false positive, our child would be okay with diet management. And another person said, I wish he had told me that it was controlled strictly by diet and that my child would be fine as long as she was on it. That would have been less terrifying than the unknown diagnosis. In terms of support groups and who to contact with questions, I just pulled out a few quotes from this as well. A way to contact others living with this disorder. We felt so alone and found the FOD's support group by chance. I wish we'd been connected to a support group, someone who'd been through this before, another parent. It almost threw me into a depression because I didn't know what it would mean, and it took me a long time to accept it and not be bothered too much by it. And another person said, a contact number that I could actually contact someone. I just got a hospital number and they were never in their office to return phone calls. So another of the main themes that we saw in terms of what else people would have liked during that initial contact, or what people felt was missing, is people felt that there was sometimes a lack of knowledge by the person making the call. And so one person said, the initial contact I had was a phone call from a nurse at the pediatrician's office. She told me my daughter was positive for PKU when she was positive for newborn screen for MCAD. She could give me no information aside from scheduling with the pediatrician that afternoon and to take my daughter to the ER if I became concerned. She wasn't very compassionate and had zero information to provide us, aside from the fact that there were abnormalities seen. So some of the other comments that people had were, yes, the nurse who called me told me the condition could be mental retardation, which had nothing to do with the condition. And another person said what the condition actually was. We were home 2 hours and got the call from the pediatrician. Some information would have been nice if they knew what he was being tested for. Kind of frightening that we had to go to the ER of the children's hospital with our newborn to be stabbed with IVs with absolutely no information from the pediatrician. Another person said, I wish the pediatrician told me the contact information for the specialist, or had a better understanding of the condition. The initial visit, when the pediatrician explained that my child could possibly have VLCAD, was confusing and very different from the explanation I received later. Having a child is emotionally and physically draining, and the information was not presented in a clear and understanding way. The other theme that we saw in these responses was that people indicated that there was sometimes a lack of empathy by the person making the call. One person said, yes, I wish the person contacting had been understanding of the severity of the news I was being given, had given some information about what was happening and what his possible outcomes were. And just a couple of the other ones, I do not know. The woman was extremely rude and made me think I was doing damage to my daughter. Another person said, I wish I had been contacted by a pediatrician with a more humane way of saying things, explaining this to us more clearly, and not basically someone reading out of a pamphlet with no emotion whatsoever. And then another person said, yes, all or any of it, any information would have been helpful. An office administrator calling out of the blue to schedule an appointment for an out-of-town blood draw on my newborn was horrifying enough. But the fact that she couldn't answer any of my questions and was incredibly nonchalant about the whole thing made me sick. In my opinion, this person was not qualified to even make that call. At the very least, this phone call should come with some resources and straight from the pediatrician himself, not from a random calendar pusher. So what this study really found is that there is some pretty big variance in the satisfaction levels, and there's some variance based off of the provider that's contacting the parent too. The major themes that we saw in the study was just a general feeling that more information is needed, or a place to find accurate information, and also that knowledge of the condition and empathy by the provider communicating the results is sometimes lacking. But some people did have a really good experience with this, especially if the person contacting them, if they already had a relationship with them. And also, families indicated that once they were connected to a specialist, they felt that they were able to have the answers they were able to get answers to the questions that they had. So the question of next steps for what to do, and I'm very curious for the people on the call today to see where you think this information should go from here. I think the results of this study kind of line up with studies that have been done in the past that centered around kind of the same central question. And I guess the question is, what do we do with that information? More and more conditions are being added to newborn screening, so there's going to continue to need to be more communication of these results to families. And I just wonder if there's a way to make this experience a little bit better for families. And so I've been kind of bouncing ideas off of people that work in the newborn screening world for the last couple of months to see what people think the best next steps would be to take this to the next level. And one of the ideas that people had given is maybe we could make a video that's particular to each state. So it would say, in Vermont, there are this many babies born every year. And of those babies born every year, about this many will have an abnormal newborn screen. And of those babies, about this many will be diagnosed with a condition that's on the newborn screen. And then from there, go into just a little bit of a background on what newborn screening is, talk about a screening test versus a diagnostic test, talk about why newborn screening exists, that it's there to help find these babies early so that we can help hopefully improve outcomes. What happens when there's an out of range result, what their next steps might be, and then possibly go into a little bit about, you now have this information. If you do want to go online and look up information, here are a few good websites that we know have accurate information. And if you're not on these couple of websites, then you might be getting information that's not accurate. And then just have some way of addressing the emotional impact that getting this news has on family members, and just giving them a couple of ideas to help them work through this process. And then maybe if people still have questions, have some sort of contact information where people can call if they have questions. So that seems like the most maybe practical step. And again, I'm very curious what people on the call think. Another possibility that doesn't seem like it would work right away possibly, but is maybe implementing some rapid genetic counseling for scenarios where people are most likely having a positive time-sensitive result, where when families are going in to have the baby's blood drawn again, if there was any way that there could be some telegenetic counseling or some way where they could connect with an expert in the field and just kind of get a little bit more information about what it means and what their next steps are. But again, I'm very curious to see what everyone else on this call thinks. So I could not have done the study without the help of all the advocacy organizations that distributed the survey to all of their members, and also all the people at Babies First Test and Genetic Alliance for being very supportive. And also just like to acknowledge again Genetic Alliance and Babies First Test, and also the Vermont Newborn Screening Program. When Cindy Income, who has recently retired, she's the one that kind of helped get this survey going and helped answer my endless questions. And if any states are on this call and are interested in possibly talking more about having a video made, I'm hoping for that to be my thesis project for my genetic counseling degree, and my contact information is on there. So if anyone would like more information, please reach out to me. And now I am happy to answer any questions.
Great, thank you, Allison. There's a lot coming in. Your presentation was great, as always, and I think the way that you highlighted the data that's out there with the numbers, as well as the experiences that families are having. Newborn screening has come a long way, but we definitely have a ways to go. So I'm going to go through some of the questions that we have gotten. One was if you could just clarify a bit that 98% number that you used in terms of 98% of the people had a diagnosis. I know that's not exactly quite the way you framed it. If you could just explain that data point, that would be great.
Sure. So 98% of the people that filled out the survey, their child was eventually diagnosed with the condition that they originally screened out of range for.
Great, thank you. And we've gotten a number of people chiming in saying they really like the idea of a video and would have a lot of ideas around how to do that. So I think we can talk more about that offline, and obviously Babies First Test is happy to continue to support these initiatives. And I'm combing through all the kudos and the good job to try to find the question. Someone was talking about how they have parent resources that they send to providers, along with kind of borderline and, out of range results. But we know that there rarely are actually having the providers, rarely are the providers actually using them and giving them to families. What do you think, and we invite people to send in comments to this question as well, but Allison, from the work that you've been doing, and now that you're in your second year of your genetic counseling program, kind of what ideas do you have around that? There's only so much. You can lead what's the saying? You can lead a horse to water, but
horse to water. Yes.
But we have. Yeah, go ahead.
So, yeah, I guess the way I see it is there's just more and more conditions that are being added to the panel, which is amazing, but what are our expectations of primary healthcare physicians? Because knowing and being able to explain to families something like spinal muscular atrophy is not easy. And expecting all healthcare providers to be able to have that knowledge or to have the time to learn it before they contact families when they are seeing patients every half hour, I don't know if long term we can expect primary care providers to know all of this information as more and more conditions are being added to the panel. But I mean, I'm really open to what everyone else thinks. But a way where even if families do not get that information during that first contact, it seems like if there was a video that kind of went through everything, and maybe even if there was a section at the end where it's like a checklist for families that says, okay, I know what the condition is. I know what signs and symptoms to look for. I know who to contact if I have questions, and then parents can write that down. And then they've got all the information that even if they didn't get it from the person contacting them, they got it from watching the video. And if they didn't get that information, they know they need to contact someone.
Great, thank you, Allison. Another question that came in is asking about if all the participants in the study were English speaking.
Yes, they were. It was English only.
Thank you. And just to let everyone know that if you're sending in your contact information or saying, contact me, we'd love to follow up, we will be sending that, all the comments to Allison as well so she can follow up. And let me see if there are any other questions. Allison, could you speak a little bit about the idea, we've heard mixed ideas around, referring to false positives in that initial contact. Some people say it's important to let people know that so that they don't completely panic, or that is the truth. An out of range result could lead to a false positive. And then others who really say, well, no, that's taking the urgency out of it, or downplaying the importance of newborn screening, or, kind of from this work, and also you as a parent who's gone through newborn screening and all of that, what's your take on that?
So I had this discussion with a genetic counselor that works in newborn screening, and genetic counselors love to talk about risk. And that was one of the reasons why when we discussed making a video, we wanted to do some sort of a graphic where, it's got the total number of people within the state, and then highlighted, one color would be about the number of people that would have, and babies that would have an out of range newborn screening or an abnormal newborn screening, and then highlighted in a different color would be the number that are actually diagnosed with a condition. And seeing that graphic as a proportion of the babies born, I think would be an accurate way to give families the idea that, okay, this is pretty rare. But there are some false positives, but there are babies that are also diagnosed. And I think that's kind of the line that you have to toe, is you don't want to provide a false sense of security, but you don't want to scare people to death. So I feel like maybe some sort of graphic would be helpful in relaying that information.
Yeah, and I think in addition to that, one thing that helps with that is knowing what are the next steps. I think when people feel like they don't know what's to come, then there's more of that chance of real, more than just being alert to something, but that panic and that like I don't know what's happening. We have someone who wrote in and said that they feel it's important for pregnant moms to have the information about newborn screening from their OBs to make them aware that there's a test that would be done soon after birth. And in her experience, or say in their experience, they didn't even know that the test was going to be performed. So then they were really confused and overwhelmed. And again, this isn't a test that's happening as like a follow-up to there being symptoms or something. Obviously, it's really out of the blue for these new families. I don't know if there's anything you want to comment on that in terms of education on the prenatal side.
Yes, and I guess in a perfect world there would be that education, and I know that there's pamphlets that are given out, but I also feel like when you're pregnant, you're going with finding the information that's most pertinent to you in that moment. And newborn screening is something that just kind of seems far away and maybe unimportant in that moment. It's not until you get that call that you realize how important it is. And then I even remember trying to go through the folder that I was given prenatally, because I remembered I'd been given a pamphlet, but then I couldn't find it after we received that call. So it's one of those things where you can push to educate people on it, but I don't know how many people would retain it. One other thought that I had is maybe one way to get more people to know about it is, and there's been some people that have talked about this before, is making sure that at your first baby appointment after your baby's born, that the results are given to parents. And then there's a conversation with every single baby. And I think it would become, people would just know more about it if it's getting discussed with every baby to a parent.
Some other comments that are coming in, one is that there could be a script that could be forwarded to the primary care provider when the results and recommendations and the actions are called out to that primary care provider. And you highlighted a couple of resources, one from the Education and Training Committee on the Secretary's Advisory Committee, and that was recently released about, screen and, what should be communicated out. Kind of what do you think about the script? On the one hand, I love that idea, and I think that's something that could actually probably be drafted pretty quickly, at least a baseline template from a lot of the work that Baby's First Test has done and then tailored for each state. But then on the flip side, we also have the comment mentioned earlier about, providers maybe getting the information but aren't passing it on to families. So what are your thoughts on having a script that could be used?
I think I'm kind of on both sides of it like you are. I think in terms of the general information about the condition, I think that that's a really great idea, because it's hard to explain some of these conditions. And so having a script in that sense would be really great. But within those screen guidelines, one of the things that it mentions is being able to kind of go off of where a family's at. So providing them with more information if they need it, or less if they need it, and then being able to address the emotional status of a family as well is not something that you can get in a script. So I think in some instances it would work, but in some instances it would not work.
Yeah, I think that's a really good point, and understanding that distinction and knowing what could be provided and templatized and scripted out, and then where do those handoffs need to be made to families, and letting the family know, like, oh, I've given you this amount of information, but here's the contact for a specialist, or a specialist will be contacting you at this point, so the families don't feel so lost. There was a comment that came in about really liking the idea of a video for each condition that a parent can be referred to, and kind of taking on that part and that work of having the pediatricians have all the knowledge right at their fingertips. And this is something that the Western States Regional Genetics Network is working on and creating kind of short videos for newborn screening conditions. I can't remember which ones they've already done, but I know they've already done some and that they're kind of working through those conditions. So that's something to definitely check out. Again, that's the Western States Regional Genetics Network that has those videos or is in the process of building those out.
Yes, and I've seen one of them, and they're great. I think these videos that I'm thinking of are more state specific. It would just be one video, and it would just be somewhere for parents to go right after they got that initial contact, that just talks really generally about newborn screening and what their next steps are and what it means to have an abnormal result.
This is a comment that's come in that's, I think, just something for you to ponder, but that this person who submitted this said that they felt like it was pretty common for families to identify anyone who called them either from a clinic or a hospital who isn't that primary care provider as a nurse, and wondering if there is a way for us to parse that out a little bit more, or maybe in a different study, ask a question around that, or, I don't know, short of saying, are you sure it was a nurse? But what that looks like.
And that was one of my concerns as well, in terms of the nurse response, because, the question is like, was it a nurse from the primary care physicians? And based off of a lot of the comments that we got, a lot of people actually said when they wrote their comments that a nurse from the pediatrician's office called us. And so I feel that most of the nurse responses were nurses from the pediatrician's office, versus I know that there's like nurses that work at newborn screening departments, and that was an option for clicking someone from the newborn screening office. So I think in those situations, people would have picked that. But I do think that is one of the limitations of the study. Yes.
Yeah, and when thinking about who to train on different communication strategies, really having to understand that different clinics and different offices have a range of different workflows, and that that could be, a couple of different people. It could be someone who's more on the front desk, or it could be a nurse that's specifically focused on education and resources for families. I'm sure those would get very different experiences depending on which person you talk to. So something to think about when we're looking at that. So we are coming to the close of the hour, and we know that people are busy and have lots of things going on. There are a couple of comments and questions that are still coming in. We will work to address those and also send them over to Allison so that she can get the contact information and all of that. And if you think of this later and for some reason can't remember Allison's email address, so it's here, please feel free to email us at info@babiesfirsttest.org, and we will pass this along. But I want to say a wholehearted thank you to Allison for all of your work on this, and everything that you've done, from being a mom to being an advocate for your child, to then deciding to go and get your degree in genetic counseling, and now with this really great data that is really just the launching off point of what we can really do to address this gap that we're seeing with families right in their when they're first getting that first contact. We all know that first instance can really shade an experience, and so we really appreciate you sharing this data. As I mentioned before, we will be providing the recording of this webinar later this week. If you have questions and you didn't get a chance to put them through the system here, you can always reach us at info@babiesfirsttest.org. And I wish everyone a really great afternoon. Thank you so much.